My name is Giovanni. I'm going to be the nurse for today, and this is my patient Anna, the COPD patient. Now, prior to every skill, there's 10 mandatory elements. Checking the physician's orders, identifying the client by ID band and explaining the procedure, allowing for understanding and questioning from the patient, reviewing the policy and procedures before, washing your hands and gathering your equipment, providing patient privacy and safety, performing the procedures using good body mechanics, documenting your procedures and findings and clients' responses, keeping the information hidden utilizing HIPAA, and reporting your abnormal findings to your clinical instructor, the primary nurse, and the charge nurse if applicable. So first I come in. Hello, my name is Johnny. I'm going to be your nurse today. Can I see your ID band? Can you give me your name and date of birth?
Anna, 1971.
Before we go, let me ask you a few questions. Okay. Do you have any? Do you get short of breath when you do any activities at home? And if so, can you name some of the activities you get short of breath for?
I always get shortness of breath, especially when I climb up the stairs.
Especially when you climb up the stairs. You get any pain around that area when you breathe?
Yes, my chest.
Now, how's your eating habits?
I'm never hungry.
And why is that?
I get tired when I eat.
You get tired very easily. Now, do you ever feel really tired in the morning when you wake up, or is it hard to sleep at night?
It's hard to sleep. I get up at night, in the middle of the night a lot.
Okay, and workplace. Where did you work, and were you exposed to any chemicals in your work? Or?
I was a pilot. We used to spray pesticide.
And do you have any family history of lung disease?
Yeah, cancer runs in the family.
Cancer runs.
Lung cancer, yes.
Now, I asked those questions to obtain information probably pertaining to the disease process, like chemicals to the workplace can affect the lungs, and I might even ask a question about how long she's been smoking for.
20 years, about 4 packs a day.
4 packs a day, okay. Now, I'm going to start with the initial assessment. Can I have you sit on the side of the bed, please? Let me help you out. Okay. Now, for my assessment, I'm going to want to check the heart area, peripheral vascular system, and the respiratory system. So first, I will start by inspecting. I will look to see if there's any jugular JVD. I will look to see the skin, the color, any masses there. I would like to see the chest symmetry, which right now you can see is 2 to 2, which indicates barrel chest. I will see the way she's breathing, how she has retractions, substernal, intercostal, or suprasternal. And after inspecting everything, then I will want to palpate. Now, usually the palpation starts from the back. I'm going to get right behind you, okay? And first, I want to feel for fremitus, and I will have her say 99.
99.
Again.
99.
One more time.
99.
And I want to hear vibrations. So if I hear no vibrations, that means there's fluid in the lungs, or they can be a collapsed lung. And after palpating for fremitus, I want to palpate for crepitus. And I will squeeze to feel any crackling sensation, which would be air. I would also do this to the front area and have her say 99.
99.
99.
99.
99.
99.
Okay. And after that, I can start to my percussions. Which my percussions start, I'll start in the back. And you want to hear the hollow sound, which is good. You want to hear that hollow sound. And now I can go into auscultation. I'll have her breathe in, breathe in, breathe in, breathe in. One more time. One more. And one last time. Okay, now I will auscultate the front as well as a lot of the heart areas. I will start with the bronchial, the bronchi, and the bronchial fascicular, then your vesicular, and the side, the third lobe on the side. Now when I listen for my valves, I want to hear nothing. I want to just hear the heartbeats. I don't want to hear any swishing, which would be a heart murmur or echo sound. So I will start with my aortic valve, which is three fingers down from the clavicle. And I will hear my pneumonic, which is on the other side of the sternum, same area. Down to my tricuspid, and then back down to the mitral. And I will also hear my apical heart rate for 1 minute. After assessing those sounds, I might also want to listen to the carotid artery to hear for any bruits there. Hey, sounds all good. Next, I will move to the extremities, because an associated disease would be peripheral vascular disease because of decreased oxygenation. So first, I will feel my pulses, brachial pulse, make sure they're even, radial pulse, and ulnar pulse. Okay, now I will check the fingers for the temperature, see the circulation. I will check capillary refill, which is good, and then I will check for clubbed fingers, which also indicates oxygenation. And I can see if they're a little clubbed, meaning decreased oxygenation. And now I will check for movement. Just can you raise your arms up? Movement is good. Put forward, press back. Okay. Now I will inspect the legs for any edema, any vascularity, any signs of anything. I will look for swollen legs right here for any signs of DVT. After that, I will palpate, feel the temperature, palpate the pulses, femoral, popliteal, dorsal, and the pedalis. After that, I will check the capillary refill of the toes. If they're painted toenails, I'll check the bottom of the toe, the capillary refill. Sounds good? Okay, let me have you sit back in bed. Last sign I will check is for the Holman sign, which you want to be negative. You feel any pain?
No.
Any pain?
No.
Okay. Time, guys. Alright?
Okay.
I'm going to ask you guys a few questions. First, I want to start with Kevin. Why do we check for fremitus?
To ensure there's no fluid in the lungs.
What would be the sign if there was fluid in the lungs?
You would hear fremitus and a vibration.
Cherry.
Yes.
Why do we assess the extremities?
To check for circulation, to check for if there is a peripheral vascular disease.
And Amanda, are bruits favorable sounds?
No, they're not. They can indicate valvular leakage and valve constriction.
Yeah.